Hello, this is Dr. Lawrence Janowski, Medical Director for Sonata Aesthetics in Broomfield, Colorado. I've been an aesthetic physician for over 18 years, and in that time, I've honed various techniques to help patients overcome one of their greatest fears, a painful injection experience. I had a patient say to me the other day as I was injecting her, "Dr. J, I hardly feel anything that you're doing. You're like a ninja." And I thought to myself, wow, that's a really nice compliment. To be able to deliver painless or nearly painless injections is an art that I've perfected over many years. And now I'd like to share some of my techniques, tips, and tricks with you, courtesy of the Injection Ninja. Hi, this is Dr. Janowski, the Injection Ninja. I'm doing a series of videos to show you injection techniques for less pain and less bruising with your patients. There are a lot of things we can do to make our patients more comfortable that we may not be doing in our injection practice. Today I'm going to focus on the cannula technique and also local anesthetic injections, which typically go together. Whenever I use a cannula, I'm almost always going to put some local anesthetic in the injection point where the cannula will be going. And then we'll show you some cannula techniques to make that less painful for the patients. Of course, we know cannulas tend to bruise less anyway. I try to use them whenever I can, whenever we're under the skin. Typically, we are using a cannula. If you're not using a cannula, you want to learn how to do that for sure, and then we'll show you some more advanced techniques with that. So I like to use 1% with epi for my local anesthetic injections for cannula technique, and I like to use this 0.5 insulin syringe to do the injecting. So we'll show you that in a minute. So I'm going to demonstrate how I put a local anesthetic injection on the skin. I always like to use the vibrato device. You've seen these before. I have another video about that. But almost always, if I have a needle in one hand, I have the vibrato in the other hand. It reduces pain. So we're going to place just a little tiny bleb here of local. And I have a separate video that shows my injection technique, which I call the snap technique, which hurts less as well. We're going to also place one up here by the canthus, the lateral portion of the orbital rim. So now we have two spots here. There's no need to go deep. We want to stay superficial. You're less likely to have a bruise here, and you just create a small bleb. Again, I like using these really tiny 31 gauge needles with lidocaine with epi with a little bit of bicarb. 1% or 2% doesn't matter. And then again, we have an anchoring finger. We have our left hand. You can grab tissue and you cannulate the pilot, and then holding the barrel of the needle, we're just going to move it up into position. You may have to move it back and forth. Then you can switch so you're on the plunger and you inject retrograde into this area. And you can compress. Again, we don't need very much. And we're going to do it in 2 sessions. We're going to underdo it a little bit. And then we can spread the tissue with our left hand. And I use these small jabbing motions so that the patient feels less. If you go slowly, they'll feel it more. So, good. We're going to hold this in this fashion. And using that left hand, a little bit of twisting, we can advance our cannula and inject. Okay. And any kind of lumps or bumps usually will just naturally settle. So remember, especially in the tear trough area, I find it's helpful to start out holding the barrel. You can start out holding the plunger as well. I just find you have a little more control here when you're in this tight spot. So in conclusion, your cannula is one of your best tools in your toolbox. It's less likely to bruise, and if done properly, can be essentially a painless injection. When moving the cannula through a difficult area, you want to use your left hand, give you counter traction, and move in short jabbing motions to get through tough tissue rather than slowly, simply because it's going to hurt the patient more. I also recommend lidocaine with epinephrine at the injection point for less bruising, less pain there. So it's the Injection Ninja giving you tips on how to have less pain and less bruising in your patients and happier patients. Good luck.